mean, firstly, can I say what an incredible day it's been? I've been thoroughly enjoyed myself. I've been inspired. I've really been valuing the opportunity to be part of such an amazing group. It's kind of blown me away, so thank you for that. I know that I've taken away a lot from yesterday's session and today that's going to make me really build and reflect on my professional practice and move things forward. You heard from our director, Peter Piot, about the conference being held at the London School of Hygiene and Tropical Medicine next year. We're going to abbreviate that to LSHTM, I think, from now on. All of our school are really excited to be hosting the conference. But it's really important not to lose the energy and the momentum that we've built up here. Heidi Larson and I are really keen to continue on that discussion with you all. We've been picking up ideas throughout the day. My notepad has been rather full as I've been hearing different comments and feedbacks from all the groups that I've been attending. I'll be setting up an email address which I'll ask the team to circulate out to everyone so we can start to get ideas directly from you. So please, if you thought about something, think, oh, it'd be really great to see this, email me. We'll do our best to incorporate it and take it forward.
They're going to need helpers.
Yeah, we really are. We really are. We want it to be something that is collaborative and people are engaged and join in with. The most important bit, I think, is to please hold the 8th and 9th of November 2018 in your diaries. Send us your great ideas, and Heidi, Peter and I will very much look forward to welcoming you to the school in 2018. So we hope to see you all there.
Hi, salam namaste, everybody. It's wonderful to be with you all, and we have had an extraordinary day. Michele, take your seat, please. I feel incredibly fortunate to have known Michele for many years. I was at Stanford here for 2 years after I left the Global Fund for Women. And we've had many opportunities to concoct lots of fun ways in which to make this space also a more equal and fair and accommodating and diverse place. And Michele continues that struggle as she works with many of you here. I wanted to say that we had this fabulous evening in which we dreamed big and dreamed bold. And I think there was nothing that was not bold about this conference this evening, this whole day today, and what we dreamed about yesterday. So I want to share a little bit with you about sort of some of what we heard. We were asked to think about what would a world look like in which the roles of women leaders in global health might actually be realized and that we would actually take it for granted. And I think that I couldn't think of a better quote for that than a wonderful quote. In some ways, I would say, what does a feminist global health future look like? To me, it challenges the game. That's what we all ended up speaking about in some way or another today. It doesn't accept it as it is. As Arundhati Roy once reminded us, another world is possible, and on a quiet day, you can hear her breathing. Well, we heard her breathing quite strongly in these rooms and in others. And I think our hope is that we really are willing to put out there that we are ready to fight for a world with different values than the ones, unfortunately, that we are seeing celebrated too often today. Misogyny, bigotry, xenophobia. We believe that that future world will be rooted in a genuine intersectional understanding. It fights for diverse representation, not just of women, because who are we if we are fighting only for ourselves and not for other underrepresented voices across the globe, whether that's trans people, whether that's nurses, whether that's people of color, whether it's people in the global south. If we as women are not willing to fight for all of our voices, then it's not the real struggle that we believed in to begin with. So I think that came out very strongly. And in particular, I think, because of where we are right now and understanding that it will not be a global north-centered set of challenges that we hope to see. It will understand that poor health has more to do with economic injustice and discrimination than it has to do with hospitals or fancy MRI machines. And we spoke today, Eva Harris and I, about the fact that Cuba has been able to do so much, and yet we are so unwilling to learn from places like Cuba and Nicaragua. But that will change in the world that we have. We will learn as much from brigade workers and community health workers in those places as we will from Harvard and from Stanford. It will not be afraid to think of what is appropriate in a conference space like this. Here we are, all of us women, all of us talking about the different ways in which we have had to, quote unquote, balance being a mother and a professional. And yet, there's not a single person in here right now comfortable with being able to breastfeed her baby in the middle of this conference. That has to change. The world that we imagine, what these conferences will look like, is not a masculine world in which we have been given permission to step into, but is a world we reshape together so that men and women together are not apologizing for the variety of different worlds and lives that we inhabit in our spaces. So our imagination needs to be able to embrace the feminine and allow that to be celebrated with all of our, and not try to simply lean in so that we can replicate male models. It values, finally, we ended with a discussion about values. We talked about this is a leadership model that values listening and humility, learning from the communities that we are called to serve in. It values boldness. I think we just heard somebody say, yes, you will have to step on some toes because we are actually shattering, we're not shattering a ceiling into a building that currently exists. We are shattering the whole model of what it currently looks like to provide global health in a world where we have to first shatter the inequalities in order to be able to provide the kind of health and the kind of access that we all believe in. It values creativity, and it is pushing, as Geeta Rao Gupta said in our meeting yesterday, it is pushing for more than parity. We have to dare to ask more than we want to be equal to. We have to ask ourselves, we want to be equal to what? What is that new world that we want to be equal to? And I think we are more than capable, with every single woman who I met here today, and with the extraordinary women that we have been a part of, we are more than capable of imagining this, more than capable of holding these conferences in Peru, in India, not just in London and in Stanford and in Paris. And I am looking forward to that. And I think that we have the capacity to do that. Join us in this global sisterhood. And thank you, Michele.
So you can see we have an extraordinary group in our steering committee. I'm going to ask Roopa to come up because I asked, Roopa's the executive director of Women in Global Health. So they're our implementing partner. And I asked her to come up with a straw dog of a way to approach moving this movement, really making this a movement rather than conferences. And she's come up with, well, we as a group all came up with a checklist and a straw dog. And she's going to present that. But really, this session is really, I'm going to turn it over to you guys, because this is where we want to hear from you about how to go forward. So she'll put the straw dog. You can tear it down. But at the end of this session, we want to have a plan with deliverable actions. So Roopa.
Great. Thank you, Michele. So what I have to say here is that I can just feel so much palpable energy in this room. It's just amazing how many great conversations, all the great connections that are being made in this room. But what's quite evident is the passion to transform global health, the passion for change, the passion to act now so that we see a different global health reality, a reality where all genders truly can be leaders. And also a place where women's leadership is celebrated, supported, and a reality. So like many of you in this room, a group of women, we found ourselves asking similar questions a little over 2 years ago when we founded Women in Global Health. I mean, there's so much talent in global health, so much diversity. The global health community is committed to social justice, but how is it that we don't have equity yet at our top leadership? I mean, look at all the potential here. Look at all the brilliant women in this room, the men who recognize the women in this room, all the women who aren't here. So we realized we wanted to see a different reality, recognize that things were being done, but more needed to be done. And so we started the movement called Women in Global Health. And we realized that it's time to not only just make small steps forward, but it's time to leap forward. And it is really A dream come true for my team to be able to work with Stanford, Global Health, the steering committee, to work with all of you here to realize this together. This is the tipping moment, or the tipping point to be exact, or the game-changing moment. It's all of us in this room and all the people streaming around and all the people we're connected to. We have so much power in this room to really transform global health. So taking all this in, Women in Global Health has been working with WHO, and we've made some strides, as you heard earlier, but that's just the start. Dr. Tedros, he wanted me to send his regards, and he says that he's here to work with us. But we need leaders at all levels to work with us, and we need all of us to work on this. So as a result of this, we took all your ideas, took all our work, all the energy, and really thought about, what it is, what are the voices saying in this room, and how can we advance this? So together, we're launching a call to action at the first Women Leaders Global Health Conference with all of you. And we're going to test it out here, so we hope you like it. As Michele said, we really want to hear from this room. For those people streaming online and those not here, please send us your feedback, because we want this to be our call to action. As we said, all the voices need to be represented in this. So I'm going to walk everyone through some of the priorities that we wanted to highlight based on what's been said at this conference. I think I lost my clicker though, but oh great, thank you. Great. So yeah, I think I can do it too. Great. So the call to action is in 3 different parts. A pledge on our values, tangible actions on what we ourselves can do, and what the global health community at large can do as well. Our call to action is that we pledge to foster and promote women's leadership in global health and to strive for gender equity in all discussions and decisions in global health. And as such, we commit to hold ourselves accountable in our efforts to advance the cause of women's leadership in global health through the following actions. 1, increase the visibility. Ensure gender balance when organizing events, panels, roundtables, guest lectures, and reading lists. There's so many opportunities out there, and there's tools out there. You can use the Women in Global Health Organizer checklist. There are many pledges, even more good practices. 2, lift women up the ladder. We heard about how important mentorship is, how important sponsorship is. Systematically include women in such activities. Invite them to your manuscripts, your book chapters, grant reviews, award nominations, even your meetings where they get to tune in, how to be diplomatic. 3, advocate for a work-life balance. Foster an organizational culture and establish norms that support men and women in balancing demanding careers with responsibilities outside the workplace. And create indicators to monitor progress. And sometimes those indicators can be as simple as Kavita said. We should see breastfeeding in a conference like this. Why not? That's a simple indicator, but it's not the one that we often measure. So think about what really does it take what does it really take to create an organizational culture change. 4, promote career advancement. Report on and increase transparency of data on compensation and salaries to understand and eradicate the gender pay gap. And we've heard throughout the conference how much more male physicians make than women physicians. We've heard about even sometimes women physicians in certain settings might have even better outcomes. I mean, sometimes men might have better outcomes. It doesn't matter what gender you are, but we should get paid the same amount for the same amount of work. And we could do a lot just by tracking it and increasing our transparency. Encourage your organizations to do that piece. 5, cultivate thought leadership. If you found this event as energizing, as exciting, well, bring it home. Why not? Organize an event, workshop, or training to discuss the issue of gender equal leadership in the organization, from a brown bag lunch for staff to a public event. Use an intersectional lens to incorporate the needs of all including members of the LGBTQI community, people of color, people with disability, and all the other voices that are not represented here. And 6, address the gender data gap. Improve data collection and tracking of the challenges women confront in seeking leadership roles across sectors. Ensure the disaggregation and analysis of data by gender in all research. So these are calls to all of us, commitments that we can make in this room. We also call on the broader and diverse community of global health organizations to take swift action to increase gender equity in global health leadership. We ask each of these organizations that we have been connected or touched by to ensure gender equity in their leadership team. Actively identify and track and report on barriers to seeking leadership roles, career advancement, pay equity between men and women within the organization. And 3, adopt evidence-based practices to promote gender parity and equality in governance at all levels. We look forward to checking in on our progress at Women Leaders in Global Health Conference in London. But now the real important part is to hear from all of you. What do you think about this? Is this the call to action you want to see, or what's missing? What can we add? Do we need to challenge ourselves more? So it's to you.
I'm going to go before FF.
Go ahead. Oh, that's brave.
That's right. I'm not scared of her anymore. She's not the dean. So, two things that, one, thank you. I know how hard you've worked. It's very impressive, so thank you very much. So two things. One, I'd really love to think about the metrics. So next year in London, can we talk about what we've achieved? And so if we could have organizations that are here, our universities, Johns Hopkins.
Can I stop you right there?
Yeah.
Cheryl Moyer, are you in the audience?
Yeah.
Where's Cheryl? We have already developed
Great.
a survey.
Good.
We have the Kaiser Family Foundation working on it. You will all, is Cheryl here? She is. Do you want to say a few words about when you're sending out the survey? We want hard metrics.
Good, because I think
metrics about the conference, the impact, if there was any. Cheryl, you want to say a few words?
Sure. So I was tasked with putting together a survey that would have a dual purpose. One, evaluating this event and trying to get some real, honest feedback about this event and how we can improve for next year. And at the same time, we have this wonderful opportunity to ask all of you questions about your perceptions of the issues within this broader, huge topic area. So you will be getting a survey, hopefully tomorrow and Monday, and maybe again the following Friday and the following Monday.
We had a big fight about this.
We would really like you to spend some time thinking about what these issues mean to you. The survey could be really short if you don't want to answer any of the long questions. It could also be longer if you want to take some time to really chew them over. And we've even given you a separate email address. If you want to write a qualitative essay, I am happy to take your data. So I encourage you to think carefully. What are the biggest issues for you? What are your big take-home messages from this conference? What could we do better next time? What are the biggest issues for younger women? What are some of the things we are missing? Those are the types of things I hope you think about when you get on the plane tomorrow. And hopefully you'll have a link so you can click on it and type. Thank you.
And I promise you, we'll disaggregate the data for the 20 men who are here.
So actually, that wasn't my question. Oh, but but thank you. So what I was really asking about is when we get to London in a year, what can we say we have accomplished? And what organizations, what goals have we set? What is our roadmap to achieve those? So let me just give an example. I'm all for lifting women up the ladder, but we got to stop blocking. There was one nurse, no midwives, no social workers. She was the token nurse. And she's retired. We need some practice that got to be on the stage in front of you. So I respect my colleagues very much, but we are 75% of the healthcare providers in this world. We need to be at the table.
You also have the leadership, though, I have to say.
And you have to respect your previous dean.
Great. So and I'm just going to make a point of clarification. In addition to the survey email, this is actually a pledge that we want all of you in this room to sign and to spread, and so that we can actually see the pledge that you've made, what is the commitment that you're committing to. So increasing visibility, tell us, how did you do that? Or how did you lift up women up the ladder? How did you advocate for the work-life balance? If you get a policy passed, amazing. I'm sure London would agree with sharing that policy. Where's Lucinda? But you know, when we see these accomplishments in the year, we want to start a movement with you. So to that whole answer, this call is for all of us to sign on, and we're going to track it. Thank you.
So thank you so much. This has been really very empowering, and it's wonderful to see so many colleagues, and particularly all the young generation here and what they are thinking about. And thank you for this. First, I was asked by Agnes to tell you that in 2019, the conference is going to be where? In Rwanda. So I'm speaking in her voice right now. It's in Rwanda. We need to keep saying that because we will definitely do it there. Secondly, I think...
Although I'm going to have to fight off Patty Garcia, who wants it in Peru.
Oh, you said Peru? We'll do it 2020 in Peru.
Where's Toy? Toy wants it in Thailand. So
sounds like it's going to turn into the World Cup.
Great.
But Agnes, I listen, I hear.
All right. Couple of things about this list, which is great. I don't believe there is such a thing as work-life balance. I think this is part of the passé. We never talk about life-work balance for men either. I think the new concept that we are all putting together is integrating life and work, integrating friends, integration, and there is a, so I really object to the work-life balance.
We'll change that.
Okay, thank you. The second thing, and I think, no, the third thing, and quick, increased visibility, I really would like very much, because it looks like gender visibility, and we want that, but I'd like disciplinary visibility in it too. I would appreciate that very much.
Thank you.
So my name is Aoife, and I guess I'm speaking as one of the under 30-year-olds, but also as a European. So the one thing I would like to maybe possibly add or speak about is the idea of community, or what I would call a tribe. So I guess I'm from a city of tribes, so community for me is a really big thing. And I think especially as a woman, it's really important to have your peers around you and to have that support network. So I think that might be something to add.
So building community.
Yeah.
Got that, Kathy? Dr. Martin.
Dr. Barry, I want to just, first of all, congratulate you, Roopa, and the team. As a man, I just want to thank all of you for informing me, sharing your views, and how we can work together, men and women, to make this world a better place. So thank you so much. I also would like to invite you as a stepping stone between the two conferences that we have our Global Health Conference in New York City, March 15th to 18th, and we want to have a half-day session on women's leaders in global health. So if you'd like to come, it's going to be in New York City. You can see it on the website, CUGH 2018. Please come, please work with us, because we're working with Michele and Roopa and many of you here. Lastly, Michele is going to be, Dr. Ann Kurth is going to be the chair of CUGH March, and Ann is here. Put your hand up, Ann, if she's here. Fantastic. Dean Kurth, the Dean of Nursing at Yale. And then following that, Dr. Barry.
I don't want to remind myself.
No, I'm doing it for you. So Dr. Barry is going to be the chair of CUGH, the largest academic consortia of institutions of global health in the world. So we've got two strong, great women's leaders coming in to take charge. So well done.
Yeah. I can't see who it is. Christina?
Yep.
Yeah.
So I'm Christina Krohn. I am wanting to talk a little bit about visibility. We talked a lot about bringing attention and helping people up the ladder. I have been very lucky. I've had so many wonderful female mentors that I don't see it as a rare thing unless I look at the data. That being said, only some of those women get credit for it. it is partly my job and those of us who are not necessarily yet in those full leadership positions to call out when they aren't getting the respect that they really do deserve. That this is somebody who should be in front of the camera, who should be up on stage, whether it's a nurse that I've learned a lot from, or another mentor who's really gone out of their way for me and isn't getting the same sort of credit as a male peer. I can say, hey, I can speak for her when she would get punished for speaking herself.
So a sort of turn on the lift women up the ladder, just who the women are.
Hi, I'm Sharon Rudy. I'm the director of the Global Health Fellows Program for USAID. And I feel a little bit like a wounded warrior here because I feel like this fight has been going on my entire life. And I'm pushing 70 now. So I was thinking, I've always been interested in the NRA and their ability to be so incredibly successful when 78% of Americans don't own guns. But they are extremely, there's a small group of people who are extremely well-funded and absolutely passionate about a certain set of beliefs, and they have this government in their thrall. And we have to have something that's similar if we're going to be successful. There has to be among us a small group that are willing to die for this. And so how do we nurture and support those who are willing to ruin their careers for this work?
Thank you. So, Roopa, do you want to talk a little bit about the Secretariat and what we've talked about? Well, actually, let's get questions. Yeah, let's get questions. We have given thought as to who those unfortunate women and men will be to move this forward. We're thinking, and if you'd like to be one of them, please. Kathy, get her name.
Yes, hello, Veronica McGarr from the World Health Organization. I think it's time for a global health report on gender and health. There's been a lot of discussions today on new emerging areas that we need to push. What we are seeing on the ground is not so much what we've talked about, but a narrow focus, again, on violence against women, reproductive rights, which we should not give up that fight. But there's, I think, a new language, new discussions, and around climate change, universal health coverage, non-communicable diseases. We will be dying of non-communicable diseases, non-infectious diseases. And so I can go on and on. Some commitment around that. Besides nurses and community health workers, the only people missing from this room are policymakers. So if we could make some recommendations that could be targeted to policymakers that could make those recommendations with us and then go to the World Health Assembly with a resolution. We've been waiting decades for a resolution on gender, which doesn't exist. Thanks.
Great. Thank you, Veronica. And I just wanted to say I was, just on the phone with the Director General about these issues, and he is very committed at WHO and working with your team, but really hope that the rest of us think about all the other actors and definitely take your call to advance it at WHO and other settings.
This is your turn.
Hi, I'm Jennifer Downs from Weill Cornell Medicine, and thank you for leading this incredible conference. There's been a lot of talk today about the need for more data and data-driven interventions, and I love the 6th point addressing the gender data gap. At Weill Cornell Medicine, we have the Women in Global Health Research Initiative, where we are really working to support women who are pursuing global health research careers. And kind of exactly between this conference and next year's, we will be having a scientific conference with presentations of research abstracts and research about promoting women in global health. That will also be in New York City, April 24th. If you're interested, you can go to our website or come see me for cards, womenglobalhealth.com. Thanks.
And if anyone hasn't read Jennifer's article, Jennifer has a wonderful article. Is it in the Annals about academic medicine and increasing women leadership? Yes.
Sorry, I'm like taking notes as people are talking while I'm in line. Hi, I'm Mariam. I spoke a little bit earlier. I'm a student. I just graduated with my master's in physiology. I'm in the middle of applying for medical schools. Just to touch on the points about lifting women up the ladder and then cultivating through leadership, I guess this is more catered towards like the younger people in the crowd that aren't so advanced in their career quite yet, because a lot of us are intimidated by all you powerful people with all the letters behind your name and all of that stuff. And of course, that stuff matters, but I just wanted to give a little bit of input about some things that I like to do. Dr. Joya Mukherjee, I think it was, spoke earlier about how to, someone's question about how to get involved with the Global Health Initiative while being a resident. And I really liked how she said basically just to focus on the way you're interacting with your patients and things like that. So I think that whenever all of us are young and we dream big about these certain movements, that we don't realize that day-to-day interactions are equally as important. And the way that we interact with each other day to day, with people day to day, really matters. So in terms of advocating with other women and lifting up other women, I think that we have to like look at ourselves and look at our flaws and see what's stopping that. And it sounds really petty, but at the end of the day, I could say that I'm a feminist and I advocate for women, but when was the last time I got mad at somebody because, I don't know, the guy that I like had a crush on her? It sounds so stupid, but in terms of like women on women attacks, that really does happen. And then another thing I just wanted to share was backstage self versus front stage self in social psychology. Also the bystander effect. I studied psychology and biology in undergrad, and when I learned about the bystander effect, it completely changed my life. And basically what that is that you don't do anything because you figure that somebody else will step in and do that, but that doesn't have to necessarily be the case. So we can all go home and change our interactions day to day with one another and things like that. And then just to touch on, like, I went to the Poverty and Organizing for Change little talk. Of course, we're very passionate. Sorry. Almost done. We're really passionate about serving underprivileged populations and things like that, but when's the last time we walked past a homeless person and didn't ask their name or just ignored them when they asked for money? That's just like one example of a difference that we can make day to day. So.
Thank you.
Lori. Hi, I have an unusual request, but I think it'll be more efficient for the time in my comment. Can Jennifer Leaning advance to the microphone, do you mind? Because I think we're kind of in sync about our concern here. I didn't get excited about this conference and go on the steering committee and everything to do a human resources meeting. I feel like I'm listening to Susan B. Anthony in the Suffragettes instead of Lucy Stone. This feels like an elite core of the top 1% of women who are able to be in public health talking about how to advance each other. I haven't heard anything about where's saving lives, where's bringing maternal mortality issues to the top of the global agenda, where is anything about the content of global health? Jennifer, do you want to add anything? What?
Well, I might be a little vaguer and less brutal, but I do agree.
Well, that's me. That's me.
But it feels to me as if this is mobilizing a group and not necessarily the top, well, it's a pretty elite group, so there I defer to you. Mobilizing a group to do what? Yeah. And that's what bothers me about this. I do believe, I mean, I like the idea of a WHO, assembly and getting a big report out. That will have some political heft. But I'm not even talking politics. I'm talking about, what about reducing inequity?
Right.
So there's...
What's the content?
So I wish, usually when I criticize something, I try to have a good idea and a suggestion. So I acknowledge that. But couldn't we just say, either in a preamble or in some other part of this, we are mobilizing in order to do the following 3 things that we pledge, our lives to commit to? That is basically our core set of agendas are around issues of human rights and reducing inequity and promoting diversity and reducing,
And I would add to that. Why should we all put in a huge amount of effort to advance women in public health if the agenda is just going to stay the same?
Yeah.
No, where's the content? Why?
I think Kavita tried to share. You guys were not on the steering committee meeting. And I think that's what Kavita was trying. Kavita, are you here? That's what Kavita was trying to. You want to say a few words? I think that was pretty much the topic of an hour and a half. Was about that aspect. Kavita, you want to say a few words?
I think that's what we do in our day-to-day jobs. One sec. And I want, Kavita, you want to say something? I don't think any of us ignore that. That's what we do on a day-to-day job.
Why I think we're just
polite, but I just feel
it's not on
there.
this. Yeah. I think that's what's important is I think we're perhaps missing the connection with the call to action that was prior to this and then the particular focus of this. So I think we were talking at a very macro level, and I think the substance that we really focused on was very much about what do we want to see as the outcomes and why are we in this field and what we want to see different about the field, and the fact that we also think that there are huge issues that affect women in health overall. So I think perhaps we, just by virtue of the fact that you have a separate organization, or rather this particular movement has a very specific focus, we somehow lost that. And so I really appreciate both questions, and I kind of like the brutality, so I actually think it's very important. Actually, because we are in a moment where we don't have, we totally realize that, we don't have the luxury. This is a country where 8 men literally own, this is a world in which 8 men literally own 50%, what 50% of the rest of the world owns. We cannot condone this system of economic injustice any longer and hope to get global health outcomes. So, I mean, to me, that's like self-evident. When we say we want a feminist future for global health, that's that future. It's not about us having better jobs. We're not saying that here. I agree. And I think that maybe we need to, but just so we can clarify that, that's the difference.
Global Health Pledge. I think the pledge that will come out of, No, I'm not asking you to sign on to anything. This was a straw dog where Women in Global Health put up theirs, and I think we need to develop what we want to come out of this conference. So that you can pull back, Lori, a little bit. I hear you. I hear you.
Can I say something too, real quickly, just to clarify? And the whole, I love being challenged. You know, I think that what you're bringing on, this is exactly what we want to do. This is the stuff that has been really trying to pull the ideas in, and the fact that it's not there. We want this exact same energy to spread throughout global health. So please, you know, continue to bring us your ideas, and we're going to include that language, Kavita, Lori, Jennifer, and everyone else that raised so many different concerns, because this has to be all of ours. So we were tasked with a very heavy thing to bring all these amazing ideas in, and there's always room for making it much better, much stronger, to really deconstruct and shift power as we've been talking about. So thank you.
Ingrid.
Thank you. Ingrid Katz, Brigham and Women's Hospital. First of all, I want to thank you, Michele.
Oh, please.
It's really hard to be the first one to do anything. And I think, yeah. And I also...
I have to stop you and just say thank you, Kathy Burke. Yes. Thank you, Rachel Leslie, Denisha Clark, Druthy. It was not me. It was my team.
I was just about to say, and your collective amazing team that I know.
It was a year of my office's
and the steering committee. Yeah. So just to acknowledge that. I was just going to add from a metric standpoint, I think the first person who came up was looking for maybe some thoughts on metrics. And I just thought about the process of accountability. In medicine, it's very much a team-based structure, and it's very small. And we have this incredible room full of women, but it's massive. And I am embarrassed to admit, if I get a survey in my inbox, it's because it's you, I will respond. But it is a rarity for me. And what I do respond to is people in my community really engaging with me. This may be beyond the scope of this, but if there are ways to directly link people in this room to each other, and we hold ourselves accountable, I think that would be phenomenal. Yeah. So I'll leave it at that.
So I think we already, Ingrid, we're going to be sending out an email list of participants so people can continue to network. So that will be in your, I hope you don't pass by with that. Do you want to say something more? You want more? Tell me more.
Well, I just thought if there's actually an intentionality to it, because I think a lot of us, you know, it's overwhelming in a way. This may be a lot to ask, but if there is a way to connect, especially senior and maybe perhaps more junior people, this might be a longitudinal plan where people could even opt in and say, I want to mentor someone from this conference. Give me a person.
I think that is great. Why don't we could also put that on the London agenda. I also thought that the idea of having hubs, geographic hubs with senior people, so that if somebody's getting bullied or if someone wants to figure out how to navigate the sharks, I spend a lot of time with women trying to tell them how to navigate the sharks in academia. So maybe those kind of geo hubs we can set up, and I think that might be more useful than one-on-one emails, to be honest with you. I think this side. Sorry, Gary. Nothing personal.
Hi, thank you so much for putting on this conference. My name is Lilian Butunji Niwagawa. I'm a director for the Center for Global Health at New York Institute of Technology, College of Osteopathic Medicine. I mean, this day was amazing in terms of that kind of discussion that went on. And I like the list, but on number 2, I think we need to create more capacity at the local level of the areas that we are going to. This
is really just a...
Yes, I see that. So that we have more people to lift up, at least at the local level.
The front lines.
Exactly.
The community.
We were in the poverty presentation, and they showcased some amazing people who are doing incredible work in maternal and child health, basically some of the stuff that Lori and the other lady were talking about. So thank you again.
Yes, no. Yep. Gary.
Gary Darmstadt at Stanford. I just wanted to say thank you for the honor of being here. I think there's a lot of men who would really like to support this. But I would really encourage the group to think about how you want to include men and how you want to bring them to the table. I think a lot of men are going to kind of hang back and are going to be reluctant to wade in because they're not sure what they should do. They're going to be afraid of making a mistake. They're going to be afraid of saying the wrong thing. They're not going to be sure that they're invited. And so I think a specific invitation to men, I think, would be important. One other aspect, I mean, as you're thinking about what exactly you want to accomplish and how you're going to measure that, I would begin to think about the accountability around these issues. I wanted to mention a new group that's springing up called Global Health 50/50. It's being led at UCL, and it's really all about accountability for gender equality within global health organizations. I think that'd be something important to bring into this. Thank you.
And when does your commission report come out, Gary?
We're putting together a series of articles in the Lancet that are really aimed at gender equality. How do we promote it? How do we get beneath gender equality and try to understand what are the roots of the inequality? How do norms? We talked a little bit about norms this morning. I don't think we talked quite enough about it. They begin very early in life, and people are often quite blind to the ways in which norms are impacting them and the ways in which they're acting. So we're trying to unpack that with data and with evidence around the links between socialized norms and the impacts on health. So that'll be coming out early in 2019.
Thank you.
Thank you.
I think we can take, how many more questions, Kathy? 2 more? Only 2 more? Really? All right. Go ahead.
Angela Migoa, pediatric rheumatologist, Aga Khan, Kenya. Thank you to all the organizers for putting together this forum. It's a wonderful platform. Mine is just to add on, it'll be very quick. Considering the bottom-up approach, other people we can include in this forum are traditional birth attendants who are conducting more deliveries, some spiritual leaders who tend to wield a lot of power over some of the choices women are making as pertains to their health, herbal specialists who sometimes are the first point of contact before they reach the clinical fraternity, and other supportive healthcare providers like physiotherapists and occupational therapists whom we could work with together to elevate women leaders in health. Mm-hmm. Thank you.
Lucinda, are you hearing that for next year? Yeah.
Hi, my name is Alifia Shambara, and I think my quick question around all of this is how do we sort of think 10 years, 15 years out? as to like the new generation of women leaders in global health or just leaders in global health. And I think a lot of what we've talked about today is mentorship and also civic engagement. I think those were two elements that stuck out to me. So I think a question that I just have for the group is, how do we make sure that we're getting more people excited about working in social justice, in global health, and providing the mentorship to not just like people like me who are still young in their career, but also those who are still even younger, who are still figuring out what careers they want, and making global health be a space, or global development or social justice be one that they would want to be engaged in.
Yes, Joya, you want to like talk a little bit about how overwhelmed you are with students in global health? I think there is tremendous energy. Joya?
Yes. What did you want me to ask?
Just about how that there is a space for students to get excited about.
Oh, yeah. Yeah, I mean, there's global health is the #1 undergraduate minor in the United States now, and I believe it's because so many young people want to make a difference. And so I would say, please make a difference. You know, don't only look at global health as some exotic thing. As you heard here, it's really about equity and about justice. And there's so many ways, I think, to get involved domestically as well as internationally, but on issues, anti-poverty issues and justice issues. And I think that's a lot of the excitement I hear from young people.
Me. That's right. She's the boss.
Sorry. You know, I hate to cut this discussion off because this has been remarkable. And I want to thank Roopa and her team and all of the other people who helped us put together what really was just a straw dog, something for us to think about. And I really appreciate all the comments. I've been taking notes. We had hoped to send it out very soon, but I think that given the reactions that we've gotten today, I want to take a little bit of time and think. You will, however, I think, get the survey very soon, and we would appreciate it if you would fill that out and get it back to us. It's pretty short. It's easy to fill out. It is also something that a few of the questions are about the conference, but it is possible to skip them if someone didn't come to the conference. We'd love to see you send it around to others in your network and get a bigger picture of what people's experiences and needs in terms of women leaders in global health.